Well, guys my age, I mean, I don't remember ever hearing the word food allergy growing up. I mean, it never even existed. Young people today, this is now such a part of our culture that it's just assumed whenever there's a gathering, well, who's got a food allergy? I never even heard that asked until 20 years ago. Well, what's going on? Well, what I would suggest is that the slinky effect, I mean, we are dealing with biological beings who can adapt and develop a little bit. We can lots of times there's a period of time between when toxicity starts and it finally manifests itself. I mean, we are very resilient beings, and the body learns to take toxicity and stick it over here in the teeth, and then you got a bunch of tooth problems at 40 or whatever. I mean, or the breast, and this is the way our bodies adapt to these things. But in the last 10 years, we've gone from 1 in 5,000 autism to 1 in 70. I mean, that's just a scientific epidemic. Food allergies, all these things, gluten. I mean, the food pyramid in 1979 put carbohydrates and grains on the bottom, but they didn't differentiate between soaked, sprouted, fresh ground quinoa sourdough bread and Twinkies and Cocoa Puffs. It's all the same. And I think it's interesting to note that Americans have doubled their consumption of wheat since 1979. That's a profound dietary change. Maybe there's never been that profound a change in the lifetime of a civilization to change something that significant in its diet. To double that. And you can map the type 2 diabetes and the obesity statistics. You can layer those directly on the food pyramid. In other words, it all developed and accelerated at the same time. So I think it's quite profound that we would actually be a much healthier culture if the government had never told us how to eat. And we'd probably have far fewer health care costs if the government had never told us how to eat. So, yeah, these allergies are simply the manifestation of improper eating catching up to us, in my opinion, because we simply didn't have them before. We had, people died, a long time ago. People died from, lack of hygiene. We didn't have piping. We didn't have indoor plumbing. We took a bath once a month. So we had, typhoid and all sorts of, infectious diseases that were, dysentery and things that were sanitation and infectious. Well, with stainless steel and refrigeration and indoor plumbing and soap and, pipes, we've kind of, gotten away from that. And what's happening now is that we have embraced a completely nutrient deficient just nutrient deficient and unpronounceable and different way of eating that is making us now susceptible to the non-infectious diseases, which are simply the chickens coming home to roost when they've been denied proper nutrition.